Feeding and eating disorders. Feeding and eating disorders are a group of mental health conditions. They are characterized by disturbances in eating behaviors, attitudes, and perceptions related to food and body weight. These disorders often involve an intense preoccupation with food, weight, and body shape, which can significantly impact an individual's physical and psychological well-being. Here are the main types of feeding and eating disorders. Anorexia nervosa. Anorexia nervosa is characterized by an intense fear of gaining weight and a distorted body image. Individuals with anorexia typically engage in restrictive eating, severely limit their food intake, and may engage in excessive exercise. They often have a significantly low body weight, and their self-esteem is heavily influenced by their body shape and weight. Bulimia nervosa. Bulimia nervosa involves recurrent episodes of binge eating, followed by compensatory behaviors such as self-induced vomiting, excessive exercise, or the use of laxatives or diuretics. Individuals with bulimia may have a relatively normal body weight or may fluctuate within a normal range. They often experience a sense of lack of control during binge eating episodes and have an excessive concern about body shape and weight. Binge eating disorder, BED. Binge eating disorder is characterized by recurrent episodes of consuming large amounts of food in a short period, accompanied by a loss of control and feelings of distress or guilt afterward. Unlike bulimia, individuals with BED do not regularly engage in compensatory behaviors. They often eat rapidly, even when not physically hungry, and may experience shame or embarrassment about their eating patterns. Avoidant/restrictive food intake disorder, ARFID. ARFID is characterized by the avoidance or restriction of food intake, resulting in inadequate nutrition or significant weight loss. Unlike anorexia, the primary motivation for the food restriction is not related to body shape or weight concerns, but is driven by sensory sensitivity, fear of adverse consequences, or lack of interest in eating. ARFID commonly occurs in childhood but can persist into adulthood. Other specified and unspecified feeding and eating disorders. These categories include disorders that do not meet the specific criteria for the disorders mentioned above, but still involve significant disturbances in eating behaviors or attitudes. Examples include atypical anorexia nervosa, meeting all criteria for anorexia nervosa but without low body weight. Purging disorder, recurrent purging behavior without binge eating. And night eating syndrome, excessive nighttime eating. Treatment for feeding and eating disorders often involves a multidisciplinary approach that may include psychotherapy, medical management, and nutritional counseling. Cognitive behavioral therapy, CBT, is often used and has been shown to be effective in addressing the underlying beliefs and behaviors associated with these disorders. Family-based therapy is commonly used for adolescents with eating disorders. In some cases, medications may be prescribed to manage associated symptoms or comorbid conditions, such as depression or anxiety. It's important to note that feeding and eating disorders can have severe physical and psychological consequences and require professional help for an accurate diagnosis and appropriate treatment. If you or someone you know is experiencing symptoms suggestive of a feeding or eating disorder, it is crucial to seek support from a qualified mental health professional.